Hello everyone, this is Vamshi Krishna. Welcome to my YouTube channel. Today we will see some of the basic questions for upcoming staff nurse recruitment examinations. So the first question is the connection between the two nerves. So here we can see the connection between the two nerves in the picture. So what is the name of the connection? Okay, options are option A joint, option B synapse, option C relation, option D articulation. The right answer is option B synapse. So synapse is nothing but the connection between the two nerves. So here you can see one nerve. Okay, so in the picture we have two nerves. So this is one nerve and this is another nerve. So what will happen here? We have a connection. Here we can see the connection. This is called synapse. So by the synapse, the information or the impulses, okay, transmit from one neuron to another neuron through the synapse. So this is the synapse. It is called the connection between the two nerves. So the next question is the digestion starts from. So when we eat food, so where it will start the digestion of the food? Options are mouth, esophagus, stomach, small intestine. The right one is the mouth. Why? Because in the mouth we have the saliva. Okay, so some of the amount of digestion start from the mouth itself. That's why the digestion is start from the mouth through the saliva. The next question is what is the action of bile? So what is the action of bile means the bile is secreted from the liver. So what is the use of and what is the action of bile towards the digestion and absorption of the food? Options are option A digestion of fat, option B digestion of proteins, option C absorption of amino acids, option D none of the above. The right option is digestion of the fat. For the digestion and absorption of the fat is responsible by the bile which is secreted from the liver. Okay, from the liver the bile is secreted and it is stored in the gallbladder, and when it is need the gallbladder will transfer the bile into the small intestine to absorb to digest and absorption of the fat. The next question is which is called smallest endocrine gland. So in our body there are so many types of glands which are endocrine and exocrine. So I am asking the which is smallest endocrine gland. Options are pituitary gland, pineal gland, adrenal gland, liver. The right one is the pineal gland. So here we can see the pineal gland. Okay, it is just under the brain and the ventricles. Here you can see the pineal gland over here. Okay, so the pineal gland secretes the melatonin. Okay, the pineal gland is secrete the melatonin and it is also known as the third eye. Okay, you just remember the pineal gland is also known as the third eye. The next question is the genetic information stored in the form of. So in our body, the genetic information where it will be stored, options are nucleus, RNA, mRNA, DNA. The right option is DNA. DNA is nothing but deoxyribonucleic acid. RNA is nothing but ribonucleic acid. Okay, that in the form of DNA we have the genetic information. The next question is the normal newborn breathing rate. So when the baby is delivered, what is the normal breath of the newborn baby? Options are 20 breaths per minute, option B 30 to 60 breaths per minute, option C 60 to 75 breaths per minute, Option D, 80 to 90 breaths per minute. The right one is the option B. So 30 to 60 breaths per minute is normal for the newborn baby. The next one is the vitamin do not find in animal food. So in the animal food we cannot find the vitamin. Which is that? Option A, vitamin B12, vitamin C, vitamin D, and vitamin K. The right one is the vitamin C. So vitamin C we cannot find in the animal food. Vitamin C is nothing but ascorbic acid, which we can find in the citrus fruits, okay, orange, lemon, like that. The next one is the total bones are present in ears, okay. Ears mean both ears. The options are option A 6, option B 3, option C 5, option D 9. The right one is the option A, that is 6. So 6 auricles are present in our human body. That is, for each side we have the 3 auricles. Okay, malleus, incus, stapes. Okay, so we have the total bones in the ear is 6. The next one is what is the hearing range in humans? So what is the normal hearing range in the human? Options are 1000 to 2000, 20 to 40, 20 to 20,000, 300 to 3000. HZ. HZ is nothing but heads. Okay. HZ is nothing but heads. The right one is the 20 to 20,000. So this is the normal human hearing range. The next one is urea is formed by. So in our body, where it can be formation of urea, we can see options are lungs, liver, kidney, and skin. The right one is the liver. So liver is produce the urea. Okay, and this urea can transfer to the uric acid, and it excreted through the urine. Urea is excreted by the feces. Uric acid is excreted by the urine. So the liver is responsible for the formation of urea. This is the end product of the metabolism. It is a waste product. The next one is the universal donor. Okay, in the blood groups, which blood group is known as the universal donor? Option A is the A, option B is the B, option C is the AB, option D is the O. The option D is the universal donor, and AB is the universal recipient. The next one is the largest endocrine gland. So which is the largest endocrine gland in the human body? Options are thyroid, pituitary, liver, and pancreas. The right answer is thyroid. So thyroid is known as the largest endocrine gland. So what is the meaning of endocrine gland? Endocrine gland is nothing but which secretes the hormone directly into the tissues. That's why we call the endocrine. Exocrine is nothing but it is secreted into the bloodstream. That is called exocrine. Okay, so the endocrine is nothing but it is a secretion of hormones to the blood, and it has the no duct. Okay, so there we cannot see the any duct or any way to the, and we cannot see the any duct. These are called ductless glands are called endocrine, and exocrine glands are nothing but duct glands, so which secretes the hormone or any secretions which has the ducts. For example, salivary glands, sweat glands are comes under the exocrine gland. So the thyroid is known as the largest endocrine gland, so which directly secrete the hormones into the bloodstream. The next one is the richest source of vitamin D. So among these four options, where we can find the richest source of vitamin D? Option A, cod liver oil, spinach, milk and cheese. The right one is a cod liver oil. So in the cod liver oil, we can find the richest amount of vitamin D. The next one is the most accurate diagnosis of cancer. So we can by seeing these four options, we can find the cancer. There is a there is a cancer we can diagnose, but I'm asking the accurate diagnosis. So which is the best and final diagnosis of the cancer? Option A, X-ray. This is R, X-ray. Option B, scanning. Option C, biopsy. Option D, none of the above. The right one is the option C, biopsy. So biopsy is nothing but taking a part of tissue, okay, uh, which organ is affecting. We are expecting that there is a cancer in a some organ, so we need to collect a small tissue and we send it to the lab. Okay, so in the lab, pathology lab, they will find the tissue structure and function. Okay, so they will find out the whether it is a cancer or normal proliferation of the tissue. So we can find the we can see, we can get the accurate information and accurate diagnosis of cancer by the biopsy, but x-ray and scanning also gives some information. Okay, so the accurate information we can get by the biopsy to find out the cancer cells. So the next one is which part is called voice box? So in our body, which part is known as the voice box? Options are option A, mouth. Option B, pharynx. Option C, larynx. Option D, epiglottis. The right one is the larynx. So larynx is known as voice box. The next one is the which gland is known as both exocrine and endocrine gland? So among these four days, which one is known as the both exocrine and endocrine? Option A, pancreas. Option B, liver. Option C, gallbladder. Option D, heart. The right one is the pancreas. So pancreas is also known as the both exocrine and endocrine gland, which secretes the hormones directly into the blood. And also why? Because the pancreas has the ducts. Some part of the pancreas has the ducts, so which it is that is known as the exocrine. And some part of the pancreas does not have any duct, which directly secretes the pancreatic juice into the blood. That's why it's called endocrine. So pancreas is known as the both exocrine and endocrine gland. The next one is which color cannula is preferred to children? So in a children, which color of the cannula we can prefer for the IV fluids or any intraparental fluids or drugs administration? Option A, yellow color cannula, pink color, green or blue. The right one is the yellow color. So yellow color cannula has the 24 gauge of size. Okay, so this is the smallest gauge. So always remember, when the gauge is decreasing, the size of the needle or size of the cannula is decreasing. And when the gauge is increasing, okay, sorry, so when the gauge is increasing, the size and diameter of the cannula is decreasing. So when the gauge is decreasing, the size of the cannula will be increasing. So here we have the different types of cannulas over here, and the red one is the 14 gauge, and gray color is the 16, and green color is the 18. So this green color is most preferable IV cannula for the blood transfusion, and the next we have the 20, 22, 24, like that. So it is all based on the size of the cannulas. So the next one is the which deficiency is called rice eater deficiency. Options are scurvy, rickets, pellagra, and beriberi. So the right one is the beriberi. So this beriberi deficiency is also known as the rice eater deficiency. So the scurvy is caused by the deficiency of vitamin C, and the rickets is the vitamin D, and pellagra is the B1 niacin. So the next one is the smallest units of proteins. So which are known as the smallest units of proteins. Option A carbohydrates, option B vitamins, option C glucose, option D amino acids. The right one is the amino acids. So amino acids are the basic components and the starting components of the proteins. So all the amino acids are become the a protein. The next one is a surgical hand washing is. So the surgical hand washing procedure, it is based on the option A elbow to wrist, washing of hands elbow to wrist, option B wrist to elbow, option C all hands only hands, option D all of the above. The right one is the option B. So this is wrist to elbow, okay, from the hand, the washing of hand from wrist to elbow. So this is called surgical hand washing. So when we wash elbow to wrist is called medical hand washing. The next one is the what is the course time of isoniazid drug in the TB patient? Options are 6 months, 5 months, 18 months, 1 year. So what is the normal course of usage of isoniazid drug for the tuberculosis patient? Option A is the right answer, that is 6 months. So for the 6 months we can use isoniazid, that is normal course of time. The next one is the thick yellow color drainage from the wound. Okay, so when we observe there is a thick yellow color drainage from the wound, what is known as? Options are serous, option B purulent, option C serous and sanguineous, option D sanguineous. The right one is the purulent. So it is purulent is nothing but infected yellow color drainage is called purulent drainage, and serous is the a white color, and serous sanguineous is the a thin thin secretion from the wound. It is like a little thickness and some of the infectious present, that is called serous sanguineous. The last one is the Schick test is to detect for. So what is the purpose of testing diagnostic test of Schick test? Option A is the typhoid, option B diphtheria, option C dengue, option D tuberculosis. The right one is the diphtheria. To find out the diphtheria we can use the Schick test. Okay, so by the Schick test we can find out the diphtheria. So the diphtheria is caused by the Corynebacterium diphtheriae. So thank you guys, this is the end of my class. Thanks for watching.